Welcome to our series, The Mind, Body, and MS Connection. Our second webcast in this series is focused on mind, body, and spirit, a comprehensive overview of wellness in MS. Thank you for joining us. My name is Eric, and I will be the operator for the presentation today. Before we get started, I would like to take a moment to acquaint you with a few features of this web event technology. At any time, you may adjust your audio using any computer volume settings that you may have. On the right-hand side of your screen, you will see the text chat window. There is a large window which holds all of your sent messages and a smaller text box at the bottom where you will type in your questions. To send a question or report a technical issue, click in the text box and type your text. When finished, click the send button. All questions that you submit are only seen by today's presenters. Your questions will be responded to in the order in which they were received and will be addressed at the end of the presentation. At the conclusion of today's program, you will be prompted to complete an evaluation. Your feedback will help us improve our future programs. We are joined today by our moderator, Rebecca King, Director of Education and Healthcare Relations with the Multiple Sclerosis Association of America, and our speaker, Dr. Laura Hancock. At this time, I would like to turn the microphone over to our moderator, Rebecca, for opening remarks.
Thank you, and hello, good evening. Welcome to the Multiple Sclerosis Association of America's live webinar, Mind, Body, and Spirit, a comprehensive overview of wellness in MS. Like already stated, my name is Rebecca King, and I'm the Director of Education and Healthcare Relations for the Northeast region, as well as your host for tonight's program. On behalf of MSAA and our presenter, we greatly appreciate the opportunity to provide the most up-to-date information and resources surrounding this very important topic, and please know that we hope you and your family are staying safe and healthy during these uncertain times. MSAA is extremely honored to host this educational program with Dr. Laura Hancock, a neuropsychologist and faculty member in the Department of Neurology at the University of Wisconsin School of Medicine. Before we begin, however, I just want to take this opportunity to thank Biogen and Bristol Myers Squibb for making this webinar possible. And as you may know, MSAA is a national nonprofit organization dedicated to improving lives today for the MS community. And in fact, this year marks MSAA's 50th anniversary as an MS advocacy organization. Some of our free services, not to tell you all of the services, but some of our free services include a national helpline, equipment and cooling products, MRI funding, an online community, webinars, and many, many more free programs available to the MS community. Please visit our website to experience our new COVID-19 MS Pathfinder tool, which is a really neat tool that provides ongoing updates and resources on coronavirus. And also please know that MSA has expanded our helpline hours to 8 p.m. Eastern between Mondays and Thursdays. To learn more, of course, you can always visit the website at mymsaa.org or call 1-800-532-7667, and I'll make sure to put that phone number right in the chat so you can see it for reference. And Wesley, please know tonight's program will be archived to our website very soon. For our Q&A session, please go ahead and type your questions into the chat box, and we'll address them at the end of the presentation. Also, if you are having any technical issues, please type those concerns into the chat box as well. We are so pleased that you have joined us for this timely conversation, and I'm honored to introduce Dr. Laura Hancock. Dr. Hancock is a clinical neuropsychologist specializing in the research and clinical care of people with multiple sclerosis. She has earned her PhD in clinical health psychology from the University of Missouri, Kansas City, as well as completed her pre-doctoral internship in neuropsychology at Rush University Medical Center in Chicago, and then her postdoctoral fellowship in neuropsychology at Brown Medical School. She's currently an assistant professor of neurology at the University of Wisconsin School of Medicine, and her current work focuses on improving our understanding of cognition in older adults with MS. And with that, I will pass it over to Dr. Hancock.
Thank you so much, Rebecca. Hi, everybody. I hope you're doing well today, and I hope you enjoy the presentation that we've prepared for you. So today, what we're going to be talking about is overall wellness in MS and what factors contribute to wellness in MS. We've got some objectives here for you. We're going to help you understand the definition of wellness, learn to better manage common symptoms through improved diet, exercise, and mindfulness, recognize the impact of comorbidities and steps to proactively manage your health, and also integrate stress reduction techniques and coping skills into everyday activities. So I am sorry to tell you that overall wellness is an active process of becoming aware of and making choices towards a healthy and fulfilling life. Which means the reason I'm apologizing for that is because wellness is a process, and wellness involves a lot of the personal choices we make on a day-to-day or weekly basis about our own lives. To the best of my knowledge, wellness cannot be captured in a pill. Wellness cannot be achieved through one great day of healthy eating and exercising. I wish that was true, but I'm sorry to tell you that it's not. So what we're going to be talking about today is how can you, as a person with MS, as a care provider of somebody with MS, as someone who loves a person with MS, what can I do to help me work on my overall wellness and help me then indirectly work on my MS and achieving the best health I can despite having MS. So we're going to talk about several main concepts today, and all of these things have an impact on overall wellness and the health of your brain. So we're going to be talking about MS care, physical activity, social activity, cognitive activity, healthy eating, sleep, and also mental health. So good MS care, I think, is fairly self-explanatory. Unfortunately, not everyone has access to an MS specialist, but if you do, if you can see an MS specialist for your care, that would be the ideal situation. But I have on occasion heard of some MS patients who are just having their MS managed by their primary care provider. Primary care providers are great physicians and providers. They are great, well-meaning people. But having someone who at least specializes in neurology, or better yet, specializes in multiple sclerosis, is going to be someone who can bring to the table a better depth and breadth of knowledge about MS research that's ongoing, new research that's come out, new things to try, and they're going to be more on top of making sure that they manage your MS-specific issues. Another factor that goes into this is being honest with your doctor and seeing your doctor at the recommended intervals. I know that's not always easy to do, and I know the coronavirus has kind of turned everybody's life upside down right now. But if your doctor wants you to be seen every 6 months for an MS check-in, maybe that interval might even be every 3 months sometimes if there's something going on. Keep those appointments if you can. Be honest with your provider. Tell them what you're going through. They can't help you with something if they don't know what's going on or what issues you're having. And, you know, I should also say another point here that your MS provider or whoever's managing your MS is also going to be your lifeline to other services that are needed. So, for instance, a lot of people with MS have issues controlling their bladder or bowels, which can be really embarrassing to talk about. But a lot of hospitals, a lot of healthcare organizations, including my own here at the University of Wisconsin, we have urologists and other specialists, gastroenterology specialists, who are used to working with RMS patients and are accustomed to dealing with the issues and the way that MS impacts the bladder function and the bowel function. And so being able to see somebody like that can significantly improve your quality of life, but your doctor is your tether to those people because they know who those people are. and they can help hook you up with them. So next, I want to talk about physical activity. So physical activity is actually really, really important. There's lots of research that tells us that physical activity, so I mean exercise, helps improve mood, improves how quickly your brain works, improves your memory skills, and also something that we call executive functioning skills, which is just a fancy term for our highest order, most complicated brain functions like problem solving or multitasking. We also know that moderate aerobic activity is really important in the long-term brain health, whether you have MS or not. So the MS research has supported this notion as well, but this is also important for healthy aging. And I'm sorry to tell you, we are all aging. I'm older today than I was last year. I'm older now than I was when I was in my 20s. So we all need to be taking good care of ourselves through things like physical activity. So the recommendation is to do something that raises your heart rate to a moderate degree. So you don't need to go out and become an Ironman triathlete. You don't need to go train for a marathon or do anything crazy. If you're not into CrossFit, you don't have to start becoming into CrossFit. You can go out and do a brisk walk. If you can't walk, you can use a hand bicycle. You could go swimming. You could do a stationary bike. You could do lots and lots of activities. Here in Wisconsin, I live in Madison. The city is sort of straddled across two lakes, one really big one and one small one. So here there's a lot of people who kayak and canoe and do other water sports when the weather is nice. You can do any of those activities that get your heart rate up. There's also some really good evidence for activities like Tai Chi, yoga, and strength training. These don't help in the same way because they're not necessarily getting your heart rate up, but they are really important for your long-term health. And specifically, Tai Chi and yoga are very good for maintaining the connection between your mind and your body. They can help improve mood, they can help improve fatigue, and they can help improve your stress management. So the goal would be, the research on non-MS people says do at least 30 consecutive minutes at least 3 times per week, but more is better. And if you're younger, the goal should be something more like 150 minutes per week if you can. Now, if you have not been doing any exercise, if you are interested in starting something like that, you should talk to your primary care doctor or your MS doctor first to make sure that there's nothing that you might need before you get started with that. So a lot of the people in the conference today are going to have a variety of different obstacles potentially to being able to become more physically active. So some people in the audience might need to work with a physical therapist first on their balance skills before they can go out and do the activities they want to do. Other people might need to meet with physical medicine and rehabilitation to work on getting some adaptive equipment that would help them do the activities they're interested in doing. So the sky is really the limit in terms of the type of activity that you can do. But the bottom line here is that exercise and physical activity is one of the best ways we have to promote a healthy brain for your life, the whole lifetime. And it also helps improve fatigue. And I can't stress that enough because we know that the vast majority of patients with MS struggle with fatigue. I've seen some papers that suggest it's up to 90% of the entire population of MS patients. So fatigue is a very serious issue, and it's very limiting and frustrating, and it kind of makes you feel like junk at the end of the day, sometimes in the middle of the day. So we know there's a lot of really good research on exercise in MS. We know that exercise helps kind of chip away at that fatigue and helps you build some tolerance to fatigue. So physical exercise is a great wellness activity that spending time doing that is spending time investing in yourself. So next, one of the important things that we also need to be doing in terms of our brain health and overall wellness is social activity. We don't always think about this as something that's needed, and social activity is something that is potentially seriously affected by the coronavirus. So this is a very timely topic for us to discuss. But humans were built as social creatures. We need to interact with each other. We need to have connections with other people. They don't have to be a certain type of person, so it doesn't have to be, a certain type of relationship. If things are not great with your biological family, that's okay. You can make relationships with other people, and those relationships will still be good and still be enough. So find ways to engage with people who mean something to you. So spending time with your friends, discussing current events, supporting each other, and talking about worries or concerns. This is it's a very important activity that can often be overlooked, especially if we have a busy life. So if you are working and let's say you have a spouse and you have children. So if you and your spouse are both working and you have children and the children have activities and there are these obligations and those obligations and, okay, now I'm going to try to carve out some time for exercise because that's really important. There's only so much time that you can spread across all of these activities. So it's important to try to figure out a way to balance that. And I don't have a magic wand to wave to help you do that. But as much as you can, involve social activity into your day-to-day life, whether that's having a regular, a standing lunch meeting every few weeks with some friends, or nowadays it might be a standing Zoom meeting with family or friends, or a FaceTime meeting, or even a phone call. All of those activities are important for your mental health. They're important for your long-term brain health. But they're also important for your overall wellness. So cognitive activity. So this is one of the things that I worry about most with my MS patients who have had to stop working or who have decided to retire. So when you're not performing mental activities at the same level, and when you lose that structure of work, this can become a really kind of hairy issue in terms of you're not really doing as many activities as you used to do. So what I sometimes see in my clinic is, somebody is very happy to retire, very happy to not have to put up with the frustrating things about work, or the person at work that they didn't like and who they kind of butted heads with, and those stresses are gone, but they don't necessarily then consider, well, what else should I be doing? So I want to challenge you to stay engaged. That does not mean you have to keep working necessarily, or if you're only working part-time, that doesn't mean that you have to be, cognitively on for 40 to 60 hours of the week. But I want you to stay engaged. I want you to use your brain, and the old adage of if you don't use it, you lose it applies here. So you want to challenge yourself. Learning new activities or learning new information, learning how to do something new like a hobby or a skill, learning a new language, learning new facts or information. Maybe you've always wanted to learn more about the Galapagos Islands. So you check out a book at the library and you start reading about the Galapagos Islands. Learning new information is one of the best things we can do for our brain health. So I put some suggestions here on the slide about things that you can do. So auditing a class at the university if you're lucky to have a nearby university or college. Learn to speak a new language like I mentioned. Playing trivia, board games, doing crossword puzzles. If you have nieces or nephews or grandchildren in your life, if they want to teach you some new game they learned, some new app on their phone. That's probably the most likely thing they're going to want to teach you. Let them teach you. You can learn something from that, and that's good social connection with that person in your life. Another easy way to challenge yourself is calculate tips in your mind. Or when you're at a store and you're shopping in an area where items are 40% off, when you're looking at something you're interested in buying, recalculate the price in your mind using that 40% off. So there are easy ways that you can stay cognitively engaged. If you're actively working and you're managing your household and you're running the kids to 5 different activities, you're probably doing enough cognitive activity, and it's more important for you to stay balanced and focus on some of the other areas of wellness where you might need to spend a little bit more time. So, healthy eating. This is a very hot topic right now. There's a lot of research being done specifically with MS to try to help us understand, are there nutritional things that could help address the symptoms of MS? Are there nutritional things that could help us maybe even sort of stave off decline or prevent a relapse? So we don't have a perfect dietary recommendation yet. I will say there are a lot of different ways of eating. I don't really like to use the word diet because to me that has a very 80s deprivation connotation. So I like to call it a way of eating or a way of life. So there are lots of different ways of eating that are sort of out there in social media and in popular media right now. So for instance, Mediterranean diet, paleo diet. There's also an MS neurologist named Dr. Walls who developed the Walls protocol for healthy eating with specific reference to MS patients. Right now, the way of eating that has the best evidence from research is the Mediterranean diet. This is probably something you've heard of from popular media. It's been highly tied to Alzheimer's disease prevention. So, and healthy brain aging. So the good news about it being very popular is that you can go to the library and probably find more books on the Mediterranean diet than you would even want. So you can go to the library, you don't have to spend any money, or you can Google Mediterranean diet and find out a lot of great recipes, eat this, don't eat this kinds of lists if that's your preference. But really when I look across all of these diets, I look at the paleo diet, the Walls protocol, Mediterranean diet, and other diets, there's a common thread through some of them that I think is important, and that is an emphasis on fresh foods. So trying to eat as many foods closest to their original form as possible and reducing our reliance on processed foods. Lots of fruits and vegetables, omega-3 fatty acids, foods that have antioxidants in them. So this would be, again, you can Google this to get a more detailed list. Berries are a great source of antioxidants, and so is chocolate. That's a piece of good news today. But the antioxidants come from the cacao plant. So, a regular chocolate bar that you buy at the store has cacao in it and usually has sugar and either milk or milk solids. So you want to buy the darkest chocolate that you can stand because that's going to have the most antioxidants in it. I do have a patient who also has diabetes who has trained himself to enjoy 98% dark chocolate, which I think he deserves a ribbon or a medal for. I don't know if I could enjoy 98% dark chocolate, but he has been able to train himself to do that because that way he can actually have some chocolate on a regular basis, whereas he wouldn't be able to if he had milk chocolate, which has more sugar in it. One trick that you could also do is take some berries, either fresh or frozen, doesn't matter. The frozen berries are just as good as fresh berries in terms of antioxidant content. So you can take some berries and drizzle them with some melted chocolate. and then you get extra antioxidants on top of your antioxidants. Anti-inflammatory spices also have a good, important place in our regular diets. So there's some evidence that these spices, turmeric, ginger, and cinnamon, have anti-inflammatory properties and they can actually cross the protective barrier around the brain. So we think, researchers think, that there's possibly some mechanism there by which those anti-inflammatory spices can help reduce inflammation in the body, possibly even in the brain. And they also just taste really good. So as much as you can, try to incorporate those kinds of spices into your cooking, into your smoothies. You can put them in your smoothies. Ginger can get a little spicy. Turmeric doesn't have as much flavor as some of the others, and then I still have not met a person who doesn't like cinnamon. I suppose there are probably people who don't like cinnamon, but I think cinnamon is a pretty well-liked spice. So incorporate these things into your diet. Try to follow the Mediterranean diet if you can, because this like I said, it has the best evidence for promoting overall health and wellness in your brain and overall health and wellness for your life. So next, we're going to talk about sleep. Now, you guys didn't think that you were going to talk to me today and not hear me talk about sleep, right? So sleep is really, really important for many, many reasons. One of those reasons is that sleep is the time when our brain spends energy trying to make repairs. So you want to give your brain the best opportunity it can to try to do some healing every night. Sleep is also the time when we consolidate memories, and sleep seems to have a protective effect on fatigue. And anecdotally, I have found in my practice that most of my MS patients tend to need more sleep than the average person their age. So for most people in the middle decades of life need 7 to 9 hours of sleep per night. And like I said, most of my MS patients in that same age range tend to need 9 or 10, possibly a little bit more. If it gets much more than that, that would be important to talk to your doctor about to see if there's something wrong with your sleep, if there's a reason why you're sleeping more or possibly sleeping too much, because sometimes there can be a sleep disorder that's interfering with the efficiency of your sleep or the quality of your sleep. And then sometimes there can also be some mood or depression issues that are affecting sleep. But as much as you can, try to get at least 8 or 9 hours per night if you're in those middle decades of life. If you're older than that, you might need a little bit less sleep. But I want you to try to be kind to yourself. This is a difficult thing to do, like I said, especially if you have a lot of obligations in your life, if you are taking care of somebody else, if you have a job that's demanding, if you have a family. There are lots of things that can get in the way of sleep, and I think as Americans, we have a tendency to deprioritize sleep. I've certainly heard more than once people say, oh, I can sleep when I'm dead, or, I'll catch up this weekend. But the evidence tells us that we really can't catch up on missed sleep. It's just gone. So as much as you can, trying to prioritize sleep. And you need to develop good sleep hygiene. So if you've been to a doctor's office in the last couple of years, you've probably heard this term. And if you haven't, what it means is having good behaviors around sleep to help set you up to get the best sleep possible. So that involves having a routine, going to bed around the same time every night, getting up around the same time every day, within a 1-hour window of bedtime and wake-up time every day of the week. To some of you, I know that's going to sound completely ludicrous, but this actually helps us get a better night's sleep because your brain knows what to expect. So just like, if you're a parent when you had a baby, you put the baby on a sleep schedule and you had a little bedtime routine to signal to the baby, hey, sleep is coming, we're going to be putting you down, and now it's time to go to bed. Our brains really like that. They like that routine. They like that predictability. But as adults, we just aren't in the habit of doing that for ourselves. So establish and keep a routine. If you can keep your bedroom as cold as possible, as dark as possible, and also have white noise in the bedroom. So that can be a box fan, that can be a humidifier, a dehumidifier, maybe even a ceiling fan depending on how quiet it is. So you want to have something that emits consistent white noise, kind of like old TV static. I'm kind of dating myself there, but old TV static that just makes that consistent noise, our brains like that, and it can help us sleep better and sleep deeper. And try to avoid screens. I know this is also a really hot topic lately. Some of you might be wondering about the blue light blocking eyeglasses. I'm not familiar with any research which suggests that those have a positive impact on our ability to sleep. And so if it's for me, I would rather just eliminate the screen for at least 30 minutes prior to bed, longer if I can. So I turn off my device, and then I will, depending on the evening, what I need to do, I'll pack my lunch, I'll listen to relaxing music, I will do other kind of quiet activities. You can read, you can even do a crossword puzzle, as long as it's not too stimulating, and then go to bed during your normally scheduled time. And then hopefully all of us can be sleeping as nicely as this dog right here, because he looks pretty happy. So next, what we're going to talk about is depression. Depression is more common amongst MS patients than non-MS patients. And the research suggests that up to half of MS patients are going to experience depression at some point in their lives. Like I said, it's more common than the general population, but also more common than other chronic illnesses. Depression can cause or exacerbate, which means it can make cognitive dysfunction worse, or it can cause it. And obviously, depression interferes with quality of life to a significant degree. So depression is something that, so we've already established at least up to half of MS patients are going to experience depression diagnosable depression at some point in their lives. But all of us experience periods of down or sad mood that kind of look like depression and feel like depression, even if it wouldn't be diagnosed that way. So how do I know whether I might have depression that needs to be addressed? So I have a little self-test for you here. Over the last 2 weeks, how often have you been bothered by any of the following problems? And then you're going to give yourself a rating: 0 for not at all, 1 for several days, 2 for more than half of the days, and 3 for nearly every day. So item 1 is little interest or pleasure in doing things. And this is the things that you can do. So give yourself a little rating: 0, 1, 2, or 3. And then the second item is, over the past 2 weeks, how often have you been bothered by feeling down, depressed, or hopeless? 0, 1, 2, or 3. So if your score is 3 or more, you should consider talking to your medical provider. You can talk to your MS specialist, you can talk to your primary care provider, you can talk to any one of your medical providers and ask them about getting formally screened for depression and working on some, treatment for depression. So what are the treatment options for depression? So even though depression is much more common in MS, that does not mean that it's not treatable. So the same techniques that we use to treat depression in other groups of people, we can apply those same techniques to people who have MS. So the research suggests that the best treatment involves a combination of medication and working with a psychologist or a therapist or a counselor of some kind. The specific types of therapy that have really good research behind them are cognitive behavioral therapy and something called acceptance and commitment therapy. So this is something that, in general, if you go to a counselor, they are going to assess you and come up with some treatment ideas, some treatment goals with you together. And then you can talk about, well, how are we going to reach those goals? What type of treatment? But if you know that you're specifically interested in cognitive behavioral therapy, or CBT, or acceptance and commitment therapy, or ACT, you can ask around and try to find a provider who is trained in using that treatment and who uses it with their patients regularly. I'm going to put in another plug here for seeing an MS specialist or a neurologist, because they are likely to have access to mental health providers who work with their patients regularly. So for instance, here at UW, we have great health psychologists and clinical psychologists who work with our patients regularly. We send them patients all of the time, and we get good feedback from our patients about the care that they have received from those people. So that is another benefit, like I said, of working with someone who specializes in MS or who sees a lot of MS patients. Another thing that's important to talk about is exercises that you can practice. So at the beginning of each day, you can write down, and the end of each day, you can write down 3 things that make you feel grateful. In our busy lives, or even if we're not as busy, this is not a practice that most people do regularly, and it's really easy for our minds to focus on the negative. So if at the beginning of the day and the end of the day, you call your attention to things that you're grateful for, that can be a really positive experience and have a real impact in terms of your mood. You could also try talking to yourself like you would talk to a friend. So when we're feeling down or depressed, it's sometimes very difficult to think about positive events or personal strengths because our lens turns very, very negative. And especially when you have MS, some of those messages can be really negative, and thinking about all of the things you can't do or won't be able to do. So if you use this trick of talking to yourself like you would talk to a friend, you would never say to a friend, "Oh, you're so stupid, I can't believe you did that." But you've probably said that to yourself, because most of us have, including me. You would never say to a friend, "You're never going to be able to do this, why are you even trying?" But you've probably said that to yourself. So if you turn that table and talk to yourself like you would talk to a friend, you're going to talk to yourself in a much kinder, more compassionate way. And it helps keep your mind on the positive, and you can track that daily. And then finally, name your top 3 strengths. So like I said, the content of your thoughts has a big impact on how you feel. And you are not going around during the day thinking about, well, I just cooked those eggs really well, that's one of my best strengths. Or I just handled that situation with my boss really well, that's one of my strengths. Again, we're having a lot of negative messages, and that contributes to the propagation of depressed mood. So spend some time once a week, once a day, thinking about your top 3 strengths. Before we move on, I'm going to challenge you to spend a moment to think about one of your strengths and to write that down for yourself. It can be anything. dog naming skills, omelet making skills, talking to boss skills, can be anything. Okay. So while we're talking about mental health, it's also important for us to talk about anxiety. Anxiety is also a very normal process that most people experience. It's an important aspect of human life. It's an important part of our brains. But anxiety can get to the point where it is interfering with the quality of our lives, and that's when it becomes something to be addressed clinically. And research suggests that up to 40% of MS patients will experience that clinical level of anxiety at some point in their lives. Again, more common in the MS population than in the general population or other patient groups. Anxiety can cause or exacerbate cognitive difficulties, just like depression. And it can limit activities and interfere with the quality of your life. And if anybody has ever experienced anxiety, you know exactly what I'm talking about. You can have a lot of physical symptoms with anxiety, like racing heart, feeling short of breath, feeling sweaty, clammy, turning red. It can be very, very uncomfortable, especially when you are in front of other people. So how do I know whether anxiety is potentially a problem for me or something that I need to address? So I have another self-test for you. So we're going to use the same rating scale of 0, not at all, 1, several days, 2, more than half of the days, or 3, nearly every day. Over the past 2 weeks, how often have you been bothered by feeling nervous, anxious, or on edge? 0, 1, 2, or 3. Over the past 2 weeks, how often have you been bothered by not being able to stop or control your worrying? 0, 1, 2, or 3. So again, if your score is 3 or more, consider talking to your medical provider about this and trying to get some help for it. What are the treatment options for anxiety? Well, for anxiety, it's a little bit different. So anxiety responds best to therapy, like talk therapy, and other similar interventions. Medications are not as helpful for anxiety. They only put a Band-Aid on the anxiety, and they don't actually fix the underlying problem. So we want to avoid medications for anxiety, and those have pretty terrible side effects, some of them. So avoiding them is definitely not a bad thing. So again, a psychologist or a therapist who can do cognitive behavioral therapy, depending on the anxiety problem, exposure therapy might also be something that is needed. Sometimes occupational therapy can help with anxiety. I know that sounds maybe a little interesting, but occupational therapists can often help us provide adaptive equipment that we need in order to perform a task better. So for instance, if I had a patient who was an avid cyclist, but is now having some additional balance problems. And so they haven't been going out and riding their bike because they're worried about falling, which is a perfectly reasonable fear. But that anxiety has snowballed into anxiety about other things, and they're just feeling really out of sorts because they're not engaging in the activity that brings them some happiness and joy. Occupational therapy or physical medicine and rehabilitation can jump in and loop us in with adaptive equipment to help. Maybe a different type of bike, maybe a tricycle, maybe a recumbent bike would allow that patient to get back out and do the thing that they love to do. And also self-care. So exercise and learning how to stay calm, how to return to calmness, and how to manage those symptoms of anxiety when they pop up, that's self-care, and that is something that you have to practice. And I do have a small exercise for us in order to practice that. So what we're going to do is we're going to be doing a little bit of breathing. I'm sorry, I forgot to advance the slides. So we're going to be doing a little bit of breathing. So it's not possible for your heart to continue racing or for the physical signs of distress and anxiety to stay engaged if we're taking long, slow, and deep breaths. So one thing for you to practice when you're not feeling stressed, so you want to practice this when you are feeling calm and feeling good, is taking in a long, deep breath, holding it, and then breathing out. So let's practice together. Breathe out. Okay. Are you ready? Breathe in. 1, 2, 3, 4. Hold that breath. And now slowly breathe out. Let's do that one more time. Breathe in, hold your breath, and breathe out. So if you practice doing this activity when you're not stressed, you start adding the word calm into your consciousness while you're practicing this activity. That might help you in the moment get over that hump of anxiety. Some of my patients have also told me they like to do this activity when they're preparing to go to bed, because it can help you calm your mind as you're trying to fall asleep. So there's an interaction between mood and cognition. Severe depression is linked to poor working memory, executive functioning, and processing speed. Depression is linked to atrophy of the hippocampus, which is the part of the brain that's responsible for memory formation and storage. And anxiety can also exacerbate cognitive dysfunction, as we mentioned before. So if you're thinking, oh, well, you know, I have some cognitive symptoms and I might also have, you know, a little bit of anxiety or depression, but I don't really need to work on those because they're not going to help me feel better or get better, I would challenge you to think about this interaction, that mood and cognition are intricately linked. This is for all people, not just people with MS, but it's especially important when you have MS to try to work on these facets of wellness that we've talked about, because that sets you up for the greatest success in terms of MS outcomes. So, what are the top 10 reasons that cognition is impacted in MS? Well, you can see here depression and anxiety are on the top of this list. MS activity in the brain absolutely can create some cognitive dysfunction. A pseudo-exacerbation. So a pseudo-exacerbation is one of those, it feels like it's a new relapse or a new flare-up, but it's actually just a flaring of some of your old symptoms, maybe because you got too stressed out or because you got too hot. Fatigue, we already touched on fatigue. Medications, sleep, exercise, lack of stimulation, and then cigarettes or marijuana. So we've talked about most of these activities or most of these factors already in the presentation today, but I want to give a little bit of a plug to cigarettes or marijuana. The evidence is really clear that like normal tobacco, whether it's cigarettes or chewing tobacco, definitely has a detrimental impact on your health and your MS disease course. Marijuana has more mixed findings. I mean, marijuana is tough because we can't study it in the same way we can study other substances, but marijuana has perhaps a positive impact on some MS symptoms, but perhaps a detrimental impact on cognitive issues in MS. And then we do have some runner-ups with pain, metabolic issues, and vitamin imbalances. So I hope that this illustrates to you just how important overall wellness is in terms of your health care and your health care outcomes. So for cognition, what can I do? You can get a yearly screening in your doctor's office. So any neurologist or MS specialist can do a cognitive screening with you that would take 10 to 15 minutes. And then you can visit somebody like me, a neuropsychologist, to establish your baseline once you have been diagnosed with MS, and then you can see a neuropsychologist when things are changing. We have cognitive rehabilitation. So we have psychologists who specialize in rehabilitation. Some neuropsychologists also do rehabilitation with their patients. speech-language pathologists do cognitive rehabilitation, and so do some occupational therapists. So no matter where you live, even if you live in a more rural area, I'm hoping that you should be able to find someone who could help you work on these issues. There are some brain games, for lack of a better term, that you can access online. There are some that are only available in a doctor's office, but there's another one that I'm familiar with. I don't have any financial relationship with this company, but the company is called Posit Science, and their product is called Brain HQ, like headquarters. So if you Google them, you should be able to find them. There's a fee for playing those games, but there's some pretty good data behind it as far as healthy aging, other disease groups, and I used that product in a study that I did several years ago, and we found some improvement for people with MS after using that product. Any rehabilitation strategy you use, whether it's working one-on-one with a provider or doing a computerized game, is going to require you to continue working on that skill. So it's sort of like, if you build a lot of muscle and then stop weightlifting, you're going to lose most of that muscle that you built. And we think the same thing applies to rehabilitation. So this is the last thing that we're going to do before we start Q&A. I want you to take a moment to consider, what is one healthy activity we discussed today that you're not currently doing that you could incorporate into your everyday life? And I want you to write that down. And after we finish today, I want you to challenge yourself to think about, well, how can I incorporate this into my life? What is getting in between me and doing this more often? And be honest with yourself, and then you can help yourself solve that problem. Whether it's getting a gym membership, getting someone to take you to a gym, getting a friend to go with you to do some physical exercise or socializing. You can brainstorm once you know what you want to do. So now I'm going to turn it back to Rebecca, who's going to help moderate some questions from you guys, and I'll do my best to answer as many as I can.
Yeah, absolutely. So we have a few minutes left for a couple of questions. And I think the first question, Dr. Hancock, that we have for you is, can lesions themselves cause anxiety, or is anxiety unrelated to brain lesions?
That's a great question. So both are correct as far as we know right now. So we don't really know yet whether disease activity of MS causes anxiety and depression, or whether the anxiety and depression is more of a reaction to having and dealing with a chronic illness that's unpredictable, that's frustrating, that's limiting, etc. It's probably some combination of both of them if I had to speculate. But you're absolutely right. Lesion, there can be a lesion that affects just the right spot enough in the brain that it disrupts the normal circuit, and it can cause an anxiety response, or it can be unrelated to the MS.
Great. And related to healthy eating, you mentioned that frozen berries are a good source of antioxidants, but what about fruit smoothies? Are those just as good of a source? Fruit
smoothies? Is that what you said? So
yes.
It just depends on what you put in the smoothie. Smoothies are great for lots of reasons. I mean, they can be very calorie dense, so if you are overweight and trying not to put on weight or trying to lose weight, a smoothie can sometimes be a calorie bomb, so to speak. But like I said, it just depends on what you put in your smoothie. If you're putting mostly banana in and then, 3 blueberries, you're not going to get as many antioxidants as if you were putting in more blueberries than bananas, for instance.
Right. I know that with smoothies too, the sugar, if you're not paying attention to the sugar can add up quite a bit,
It can get
especially
very, very high. Yes, yeah. So you want to, look for ways to balance that out. One thing that I do is I put frozen spinach in my smoothies because frozen spinach, I really can't taste it once I put in some vanilla protein powder, I put in some berries, I put in some cinnamon and turmeric and ginger, and then I can't really taste the spinach or even the turmeric or ginger very much. So you can kind of hide some healthy things in there without getting the sugar content up too high. But it's a great question, and if you are interested, I'm sure that your healthcare provider knows dietitians who would be very happy to help you kind of troubleshoot that and help you figure out ways to incorporate some Mediterranean diet factors into your everyday eating.
Right. That's definitely a great way to hide some veggies, especially the green ones.
Mm-hmm.
So in terms of sleep, this is a really great question. This person stated that they understand the importance of getting 7 to 9 hours of sleep and having a sleep routine, but what if your schedule doesn't allow for that? So this individual, their work schedule changes depending on what shifts they work, and even if they are able to get 7 to 9 hours, it can't be necessarily routine.
Yeah.
Do you have any suggestions for them?
That's a really tough one. I mean, I've had a handful of patients who are in this position, and I really feel for them because, it just really sucks to have to go back and forth to different shifts. So, obviously, one answer would be, and this is not necessarily possible, but if it is possible, one answer would be to, ask to get permanently put on just one shift, or change your job if that's possible, to be working a job that has just one shift. The evidence suggests that the exact shift doesn't matter, so whether it's first or third really doesn't matter. But in terms of health outcomes, but I think in terms of mental health outcomes, it probably does. Because if you're on third shift, but all your friends and family are on first shift, that can be kind of a lonely experience. So as long as you're getting 7 to 9 hours of sleep, if you can do the other sleep hygiene techniques, despite the fact that you might be going to bed at different times, I think that would be great. So, my biggest concern would be, can you fall asleep if, one night your bedtime is 1 a.m. and the next night your bedtime is 10 a.m. So try to get as much sleep as you can because that quantity seems to matter.
And speaking of sleep, Dr. Hancock, what are some natural supplements, if you recommended any? Of course, there's melatonin, but are there other supplements that you can take to help you sleep?
For sleep, melatonin is the most common one, I would say. Really the evidence suggests that we should be trying to do those behavioral strategies instead of supplementation. On top of that, I am a psychologist, not a physician, so I can't recommend certain medications to you without talking to your doctor first to make sure that they would be okay for you to take. I would also avoid drinking anything that has caffeine in it, or eating foods that have a lot of sugar in them too late in the day, because that will impact your ability to fall asleep. So, everyone kind of has a different cutoff time for those kinds of things. For me, I did trial and error, and I found out if I drink coffee after 3 p.m., I'm not going to be able to fall asleep when I want to that night. For some people, the cutoff might need to be earlier. So and be mindful of things that you're having that might have caffeine in them that you don't realize have caffeine in them, like chocolate, like certain energy drinks. Like some things are branded or marketed a certain way, but they actually have caffeine in them, even though you think that they might not. So you could try things like that. And then, like I said, establishing that bedtime routine, because that basically, it's sort of like you could kind of think of it as your brain as being like a computer. So your brain can't just all of a sudden shut down or shut off. I tried to snap my fingers, but I didn't do that very well. So your brain can't really just shut off. It needs to boot itself down. It has little processes that it needs to take before it can help you get to sleep. And so if you cut off the caffeine, if you cut out the sugar, if don't work out at 9 p.m. at night and then expect to fall asleep at 10, those kinds of things can help us. Doing regular exercise does help overall with sleep. So if you can incorporate a little bit of exercise into your routine most days of the week, that will overall help you sleep better, even on a day that you didn't exercise. And then I would say the other kind of big influencer for sleep is anxiety. I have lots and lots of patients who say, I can't turn my mind off. My mind is racing when I try to go to sleep. I'm thinking about all the things I need to do the next day. So taking a moment before you go to bed to jot those things down. This is going to sound silly, but my patients tell me that it helps. So jot down those things that are kind of on that loop. Okay, I gotta remember, I gotta call this person, I gotta return this email, I gotta do that. Write all those things down. And then here's the goofy part. Tell the paper it's your job to worry about that. I'm going to sleep. And that can help kind of create a separation in your mind to stop the loop. And hopefully then you'll be able to fall asleep better. If sleep is really, really bad and you've tried melatonin and you've tried all of these other things and it's not helping, I would encourage you to talk to your doctor about some options.
Great. Well, we are at the top of the hour now, so that concludes tonight's webinar. I would once again like to thank Dr. Hancock for your insight on personal wellness and self-care. It's really much more complex science, I think, than we typically give it credit for. And I would also like to take time to thank our funding partners, Biogen and Bristol Myers Squibb, for providing support for this program. As mentioned, tonight's webinar will be archived to our website, and anyone can access this over the next couple of weeks. We ask that you take a very brief survey that is coming up right after you exit the screen. Our funding is dependent on our evaluation, so please just take a couple of minutes to answer a few questions for us. And on behalf of MSAA and Dr. Hancock, we thank you so much for joining us.